I am Ben Eberly. I'm a retired pastor. And about 9 years ago, I was diagnosed with a very aggressive prostate cancer. They prescribed a very aggressive treatment plan of radiation for me, which I scheduled. But in the meantime, I was looking for an alternative, knowing that I did not want to do the radiation. And that's when I was introduced to Relive. I flooded my body with the products for 12 weeks, returned to my urologist, and he said, according to your blood work, your cancer is in remission. He canceled the radiation treatments that had never been started. I've had no chemo, I've had no radiation, I've had no surgery.
Wow.
And when I said I flooded my body, I was taking 6 double shakes a day of the 3 basic products at that time, which was Classic, Energize, and Fiber Store. I'm also a diabetic of over 35 years. Before Relive, I was taking many different medications. And but after I was on Relive, I noticed my blood sugars were steadily coming down. So I began to reduce the amount of medication that I was taking. And when I went to the doctor, I told him what I was doing, and he couldn't argue with success, and so I continued to do what I was, and my blood sugars continued to go down to about half of what the medications that I was taking had been. And then our company came out with a new product called Glucofect, and I added that to my shakes 4 times a day. And in a short period of time, I was able to completely eliminate one of the medications that I was taking. And today my blood sugars are more stable, and I just am really thrilled with what it's done for me with my diabetes. I also have 4 stents in my heart and blockage where they could not put stents. They were treating that medically, and after being on Relive for 6 months, my cardiologist discontinued the medication, saying I don't need it anymore.
Wow.
And that's been well over 8.5 years ago. And I have degenerative disc disease in my lower back. I used to take 800 milligrams of ibuprofen 3 times a day just to control the pain so I could continue to get around. Today, that pain is completely gone, and my knee is completely gone, and my back is mostly gone, and I'm able to do pretty much what I want. I'm soon to be 84 years old, and I feel great and able to do pretty much what I want. And with that, that's my story, and I'll share a bit about Martha. Martha also got great results with the Relive. She's also a diabetic and was taking as much oral medication as they could give her, and they started her on a shot of insulin. And soon after taking Relive, she was able to completely eliminate all of the oral medication that she was taking, and she still gets 1 shot of Lantus long-acting insulin per day. And she had a cornea, a problem with her retina in her eye, and was much worse in one eye than the other. And then she was able to put off having cataract surgery for many years, but eventually she did need to have cataract surgery. And her retina problem was something that she simply had to deal with, but her vision had improved to the point that she was, 9 years ago, her vision was so poor that she, after reading the chart 4 times, she finally got her driver's license. But about 6 months after being on Relive, her vision had improved to the point where she was seeing 20/40 instead of 20/200. And so she'll be on Relive for the rest of her life also. And so that's what's happened for us.
That's awesome. And Martha is a retired RN, a registered nurse as well.
Nurse, LPN, a retired LPN.
Okay. Wow. I mean, that had to have been quite a surprise for her, seeing all the results that you two have had.
Yes.
That's great. Well, Ben, thank you so much for joining us and sharing part of yours and Martha's story. We appreciate you so much.
You bet.
Thank you.
Bye.
Well, next we're going to head over to Illinois. It's my pleasure to have with us tonight Colleen Sider. And Colleen, we'd love you to come on and share.
Sure, Bill. Thanks for having me. Hi, everyone. My name is Colleen Sider, and I'm from the Chicago suburbs. And our journey started when our oldest son was 5 years old. He was diagnosed with ADHD, and we were pressured to put him on Ritalin. He developed horrible side effects, including motor tics. And this started our quest for alternatives. We tried just about everything under the sun, and it wasn't until he was in 6th grade that we were introduced to these products. Once he started taking the products consistently, the next 3.5 years were the best years of his school life. He became more sociable, more outgoing, better eye contact. He was joining the sports teams and the clubs, and he was just a happy, normal kid. Unfortunately for us, we took the products for granted. We stopped being consistent, and by his 2nd year of high school, he had a major setback. He was having panic attacks and anxiety, and at this time, he was given additional diagnosis of Asperger's, which is high-functioning autism, and OCD, which is an anxiety disorder. And it took me 2 years to make the connection that when he was taking these products, he was doing so well. But as soon as I did, I got him right back on the Relive products, and it was just in time for him to start college. He went on to graduate from college in 4 years, top of his class. He did 1 year of graduate school, but he put that on hold because he got a full-time job in his field as a computer programmer, and he's been doing that for the last 3 years or so, and he's just doing great. And, you know, thanks to these products, I was able to avoid taking cholesterol medication, and my husband was able to avoid taking high blood pressure medication. So we just thank God for these products, and we'll never stop taking our shakes.
That's great. Now, Colleen, as I recall, you had some skin issues as well.
Yes, I had eczema on my arms and legs real bad, and, you know, I wasn't even looking for that as a result. And it was about 6 weeks into the product that a friend of mine was she kept asking me, well, what other results? And as she's saying that, I was scratching my arm thinking, oh, my gosh, my eczema is gone. So that was a very nice surprise.
Absolutely. So you said that, you know, your son, you know, he got off the Relive for quite a period of time, and all these things hit him. So what's happened with the Asperger's and the OCD and the panic attacks at this point in time?
You know, kids with those issues, I mean, you know, like Relive always says, we never claim to cure. And so he's not cured of these things, but he can handle situations so much better. And at work, if he's got a big project coming up or if he's kind of overstressed or anxious, he just has another shake, and it just helps calm him down.
That's great. Colleen, thank you so much. Appreciate you being on and sharing tonight.
You're welcome, Bill. Thank you.
Thank you. Now we're heading over to St. Louis. Darwin Latiker, we'd love you to share for us here tonight. Can't hear you yet, Darwin. If you hit *6 earlier, you would...
St. Louis, Missouri. I was diagnosed with a rare disease called sarcoidosis in 1994. I was put on prednisone, Allegrity, Deslin Pearl, high blood pressure medicine, an inhaler. Had 3 kidney stone surgeries and 2 sinus surgeries between 2000 and 2003. I had Bell's palsy on the left side, the right side, and then both sides, which is very uncommon. And then the ophthalmologist had them check me for sarcoidosis because of something she read in one of her magazines. And that's what they found. So they was treating me with all these different medications to treat the symptoms, and nothing seemed to work. I started going back and forth to Chicago to see an iritis guy, and he actually would look in my eyes and make a potion for me to drink, and I'll bring it back home every other week, and that didn't work. I started taking anything I could find in order to help me with my immune system because it was so suppressed. I had to take a job working on the inside because I just couldn't work outside anymore. And then in October 2003, a guy at my church told me about these products called Relive. I went to a meeting. I saw people getting tremendous results with high blood pressure, diabetes, cancer, a host of other illnesses that I had never heard of before. So I tried the products. In 6 weeks, my kidneys got better. In 8 months, I came off prednisone. I had been on for 9 years. I started getting better and better. In 2006, I was able to go back outside and work out in the field again, go out and play golf, do a lot of things that people told me a person with sarcoidosis shouldn't be able to do. And the very first month I came into this business at the top profit level, I made over $800. And that was just by sharing it with people who knew me because they saw how things were going. I've been taking these products, sharing them with people, and I love the products. They've given me back my life, and I'll always be on them. Thank you.
That's awesome. Sarcoidosis. Most people don't know what that is. How would you describe that or explain that?
Sarcoidosis is like an autoimmune disease. It can affect any part of the body. I met some people where it affected their skin. Other people, it affected, their kidneys and things of that nature. With me, it was attacking my eyes, my kidneys, and my sinuses. And it can attack any organ in the body. So you can just imagine it attacking any place, your eyes, your kidneys, your skin, because it's your largest organ. And they don't have a cure for it. It's common between black females between 20 and 40, and a lot of other people get it, but when I got it, they really had a hard time trying to figure out what it was.
Mm-hmm. Wow. And the kidney stones, you haven't had any more kidney stones?
I have like little kidney stones, but nothing to what requires surgery.
So you had 3 surgeries before?
I had 3 kidney stone surgeries before, right? The left side, the right side, then the left side again.
Those are not fun.
No.
Those are not fun. So, and congratulations. As I recall, you got married to Kim here a month or 2 ago.
We got married this past Saturday.
Ah.
Well, not this past, the Saturday before, the 23rd.
The 23rd.
Yeah.
Okay, so that's even more recent. Well, congratulations.
Thank you.
Okay. Thanks, Darwin. Appreciate you joining us.
Welcome.
All right, over to Michigan. It's my pleasure to have with us tonight Eileen Tesh, and she's a senior director with Relive. She's had some really good results. She's also turned around and helped lots of people and had lots of fun with Relive. And Eileen, we would just love you to come on and share.
Thank you, Bill. Good evening, everyone. I am Eileen Tesh from Algonac, Michigan, and it was about 9 years ago that I was introduced to these products and this company. At that time, I was running a very busy law firm, working 80, 100 hours a week, stressed out, burned out. I thought they were going to bury me in that office. But here came Relive, and nobody ever told me anything. I never saw a presentation, never heard any stories. My sister is the one that came over one day with these cans and said, we're going to try this stuff, and if we like it, we're going to start a business. I said, are you crazy? And she said, oh, no, you don't understand. And she was telling me about her friend's mother and what happened to her, and that really didn't impact me because I was not sick, although I must say that my diet did consist of caffeine, nicotine, and happy hour. That was what kept me going, and at 45 years old, I knew that I needed to start making some health changes, but like a lot of people, didn't even know where to begin, especially keeping that kind of schedule. So, but when she said, well, her friend's mother makes $5,000 a month and never picks up a can, I'm like, give me that stuff. So in my first month, I quit smoking. I lost 10 pounds, quit drinking coffee. My depression disappeared. My skin cleared up, and I just had this overall sense of wellness. And people started noticing the change in me. It was so funny because one time when my mother asked me what I was doing, and she said, your skin is so clear. And I actually had to go look in the mirror to see that, did I really look that different? But when a couple of my clients saw the change in me and started asking me what I was doing and wanted to know more, and I said, look, I know nothing. I'm just trying this product and learning about this company. And they said, well, how can I get some? So I connected them with my support team, and that's one thing that I love about this company is that everybody working together and helping each other and really just to, make sure that we we understand what we have a hold of, how to use the products, how to be consistent, which is key. And my support team got a few of my friends and clients started, and they got results. But it wasn't until one young mother came back to the office and hugged me because her little girl got off her ADD medication. And that's really when it went from my head to my heart. And I thought, wow, I could help a lot of families. Because when I became an attorney in 1983, prior to that, I had never heard about ADD, ADHD, autism, and obviously now it's an epidemic, and many of us have seen what Relive has been able to do for these children and these families. I also, Relive, I do contribute a lot of my next benefit to the Relive products and the company. I found a husband. Not too many men wanted to marry divorce attorneys, and I probably wasn't really a very happy person anyway. But I did meet my husband, Jim, and shortly after I got started on the Relive, he's a veterinarian, and when that was the first time I was exposed to what he shared with me was sleep apnea. And so he had severe sleep apnea. They did all kind of studies. They told him it was so bad surgery wouldn't help. But he got started on the Relive, and he was very impressed with the ingredients and the clinical studies and the patents, because being a veterinarian, obviously, he knows a lot about nutrition and food. And in about 4 to 6 weeks, he also saw great results with the sleep apnea. He barely snores anymore. He wakes up fully rested, no more dark circles under his eyes. He also got wonderful results with carpal tunnel syndrome. His hands used to fall asleep during surgery, and he'd be banging them on the operating table. And then he had diverticulitis, also issues with his knees and his back and his neck. And, it's amazing, especially since the Lunasin capsules came out. We just played 9 holes of golf yesterday, and I'm like, how are your knees? And he said, he said, they don't hurt. So we are, just so blessed every day to have a hold of these products. I didn't really have any desire to or interest or didn't even think I had time to do any business or do this business, and I certainly didn't know anything about network marketing. But when that young mother came back to the office and I took Jim to a special event in Chicago, and then we went to the international conference, and he was so impressed and having met Bob Montgomery and Sandy and Dr. Hastings, and he said, that we should definitely, he didn't have the time, but he said if you can find the time, we should definitely do something, get involved or at least share it with others. And in 3 years, part-time, around my very, very busy schedule, but with the help of my support team and plugging into the system and learning how to do this business. because I when I came out of the gate, I said, I know one thing. I know that I do not know how to do this business. I didn't even know how to talk to people because, it's a little different talking to people as a lawyer and talking to people about Relive. And 3 years part-time, I was able to resign from the law firm, earned over $4,000 that month, became a key director, and never looked back. I do this full-time, and every day, just a blessing to be able to help people, give them hope, and see the changes in them. I love what I do. The money's great. We just came back from Cancun. Relive trips are amazing. But what this company really has given me and given us is passion and purpose back in our lives. And my husband can't wait to retire in this next year and sell his practice and come on board and do this full time for however long we have on this God's green earth here.
Eileen, that's great. Thank you so much for sharing with us tonight. I appreciate you.
My pleasure. Thank you, Bill.
Thank you. Well, I have one more guest for you, and what a privilege for me. I get to introduce you to Sandy Sopko. She's a presidential ambassador with Relive. Big title for those of you who don't know what that is, but she has helped lots of people and has a real heart for making a difference in people's lives and loves to turn around and teach other people how to help people. And she has done so beautifully, and it's our pleasure to have Sandy share. So, Sandy, we'd love you to do that. Can't hear you yet, Sandy.
Are you able to hear me?
I got you now. Go right ahead.
All right, great. Well, I'm always glad to share, and June 18th will be my 18th anniversary with Relive, and you never forget some dates in life because of what it has done for our family, and especially for my failing health, and that put us $50,000 in debt. But I am Sandy Sopko from Surprise, Arizona, and I am just so excited to be a healthy wife and mom of 4 older children that are out and about and 4 grandchildren, but it wasn't always that way. I had been in 4 car accidents before I was 25, and I was working in the medical field of radiology, and over the years that working on the hard floor and moving heavy equipment and people around, I just started to have a lot of neck, back, sciatic problem, developed into some serious digestive disorder when I started having scoliosis between my shoulder blades, and the chronic fatigue was taking over. And you don't realize that you have a health problem. I thought being a mom of 4, I was just exhausted because I'd never been a mom of 4 before either. But when I realized that there was more to it than that, I started seeking help and doing alternative. And over a period of 23 years, at age 31 is when it really hit me. And I was 54 years old, almost 18 years ago, when I found Relive. And I had gone to alternative, eating organic. I had gone for treatment, massage therapy, chiropractic. I did everything to get out of pain and get my energy back, and I was still struggling. By 8 o'clock at night, I was going to bed and getting up every day as if I'd never been to bed. And, you strictly push yourself because I didn't have the ability to go on retirement and disability. I still had 4 children that needed to have a mom, and we needed to have income. And I was working, and at lunchtime I would take a nap every day. I was very fortunate. The doctor I worked for took an hour and a half off every day, or I wouldn't have been able to keep a job. So long story short, it started to turn things around, but it took me almost 5 months to get enough product in my body to rebuild 23 years of deficiency because I wasn't digesting and absorbing. And they had misdiagnosed me for many years, and I had thyroid disorder that had caused chronic pernicious anemia. And that means my red blood cells were shrinking. So that was really a big issue with the chronic fatigue. I wasn't having enough blood supply to give me the good energy that most people have. And then, of course, as the years went by, my body started to really have more and more problems from all those injuries. And you don't recognize that it's going to happen that way, but it does. So today I'm going to be 72 this year, and I feel like $1 million. And, you know, my husband is doing very well, and he was born with some genetics of heart problem, and age 30, high blood pressure, unmanaged, almost stroked twice. He lost his mother at 40 and his father at mid-50, so there were the genetics. And today he's healthier than ever. He doesn't have any of the issues that are debilitating and maybe causing a risk for him to have another stroke, because twice we almost had a stroke from the unmanaged high blood pressure, and thanks to Relive, that's all under control. And my real story that I love to share is my grandson, who was a 4-pound preemie. And when I found the product, he was 5 years old, had been on antibiotics, upper respiratory problems, and just really struggling. And I knew this was not good to have so much antibiotics in a young child. So today, fast forward, he's 23 years old. He plays college offensive line football, and his good health has given him $150,000 of education. That is a price tag that you just can't, you're so thankful that your child and your grandson is healthy. And we are blessed, and we've been part of this business now. I took a serious look about 6 years after I was on the product. 6 months after I left the medical field, I did replace my income. And to fast forward, by our 3rd year, we had earned over $90,000 for part-time. And that was really what got my attention. I wanted to have time freedom. And 13 years ago when I left, I was turning 60, and most people don't do a career change at 60, but I knew Relive was giving people quality of life, and I was not able to do that in the field that I worked with. I was diagnosing diseases, and I was doing cancer treatment, and I was so excited to be on the other side to let people know that there was something that could be a preventative and could help them recover. You know, it's just a matter of making a choice to do what was right so other people could have quality of life.
Wow. Well, you have a pretty amazing story. There's a lot of story that got left on the table there. And let me just draw a little bit more of it out. You had some pretty severe digestive issues, and for a long time, it seemed to me it was like 20 years you dealt with some systemic things. Why don't you talk about the digestive side of some of those issues you fought?
Yeah, I really believe some of it was from the car accident when I developed the scoliosis that affected my digestive tract. I developed a very severe autoimmune disease called systemic candida, and that's about as bad as you can get because I had no immune system, and I got so sick that I lost 30 pounds in 1 month. And I ended up in the hospital for 10 days, and they still didn't have a diagnosis of what was going on. So when I found Relive, I had done everything. And here I was in the medical field, and 5 doctors, gastro specialists, all of the internals, they had no idea what was going on. Because years ago, they didn't know about systemic candida. They didn't know about these serious problems. And today, I can eat just about anything and everything because I was on a gluten-free diet and being very careful, but I was still not well. So it has taken time. It took years for my body to recover, but I had to have about 15 months to really have enough product in my body to recover.
Mm-hmm. And you were taking a ton of supplements, as I recall, I mean, before Relive hit.
I was taking 20 to 30 supplements 3 times a day when I sat down to eat my meals. I had so many pills and tablets from a naturopathic doctor, from a PhD nutritionist, and I was just following what they were telling me because I knew nothing about nutrition. I just did what they told me, and then I did the organic food. And the only way I can get down that amount of food or pills, I had to take a bite of food and put a pill in and swallow it. Wow. I could never take 20 or more pills with water, just, straight down.
My goodness. And you had some issues with E. coli at one point?
When they tested my stool, they found that I had triple the E. coli. The bacteria in my body was triple of what it should be, and that's why I couldn't get past being sick because it was literally attacking my system with the infection.
Okay.
And that's what systemic candida does. It literally starts to get into your bloodstream, and every organ in your body begins to have a problem.
Right. Yeah. Wow. So you appreciate being healthy and having energy and able to do things.
Well, that's true. And my initials are SS, and I call myself Sassy Sandy because, you know, you don't appreciate good health until you lose it. I lost 23 years of my life with chronic fatigue and couldn't do the things that normal people do with their family. I had to rest if I was going to go do anything because of the chronic fatigue. So, yeah, I'm excited to be healthy, and I'm not 72 years old. I am young. I am actually living the years that I lost.
There you go. That's awesome. Well, tell me about the Relive side of it. Now, you've built a very large Relive business, help people all over. Your business is taking you all over the country and probably to some of the other countries of the world, as Relive is international. But
yes.
Where did it all begin? I mean, how did you get this thing started? You had a lot of health issues.
Well,
so how did you start sharing and building a Relive business?
You know, I heard people complaining, and like I said, I didn't do a business on purpose. But I did have a passion to help people get their life back. And when I'd hear them complain, I'd ask what they're doing, and then I'd say, well, what if this works for you? I mean, I didn't know what was going to help anybody, but they got results before I did. And I had someone whose husband was totally debilitated with a herniated disc and unable to even walk upstairs and had been 3 months on a sofa. I met her when I was out networking and got them started on the product, and in 3 months, his back surgery was canceled. And then he had incredible results with a rare leukemia with no medical treatment. And long story short, they are now ambassadors, and she has a dual citizenship with the Philippines, and they have built their business in the Philippines, and they're both there now working the Relive full time. Wow.
And who is that?
That's Maria and David Lyons.
Yes.
And they also have frontline ambassadors, Dory and Steve Hay, and they're here in the U.S. in Phoenix, and she will be returning to the Philippines in 2017 to be there full-time again.
So have you been over to the Philippines?
Yes, in 2009, I spent 2 months. This is when we were starting the process of setting some goals and building the Philippines and having a leader over there from our team. And I spent 2 months there. We set up a feeding station for special needs children, Down syndrome, autism, and cerebral palsy. And they feed 15,000 there with our nonprofit from our company. And that's such a passion for any of us that go over and see that these children have an opportunity to have a quality of life because of Relive. So I did visit back in 2011 at the international conference, and I plan on going back in 2017.
That's great. Well, Sandy, if someone said, you know, I have a real heart to help people, I'd love to do that, and I really would like to build a business, I could use the income. So what are the basics to building this Relive business and helping people?
You know, I'm so family focused, and I've always believed that our business is based on looking at the family needs because we need to bring up a healthy generation of children. And you look at a family, you got mom and dad, you got grandma, grandpa, there's brothers and sisters, nieces and nephews, and you've got a nucleus of people, and they all need to have quality supplements so that we can do the best to prevent the problem. And so that's my focus. If I can have 10 families, that's what I do. I help people get 10 families on this wonderful product, and that's how the business starts for me. I always thought of 10 people who have family that want to have the best nutrition for the family.
Okay. All right. Well, I'm running short on time. Sandy, it is always a pleasure. I so appreciate you and your heart to make a difference in the lives of other people. We appreciate you sharing. Thanks so much.